My name is Muhammad Azamul Aniq, and today we will gonna talk about the introduction of how nurses can apply their social science knowledge in their clinical practice. Social sciences is a branch of studies that deals with human behaviors and the development of changes in their sociocultural, economic, and also their lifestyle. Social sciences study can be divided into a few parts, and some of it is anthropology, economics, history, human science, politics, psychology, and also sociology. The understanding of social sciences is the key for the issue that recently emerged, which giving impact for human, economic, and environmental sustainability. Nursing profession is recognizable in providing the social welfare to communities and clients. It is essential for every nurse to understand the knowledge of social sciences in order to understand the behaviour of clients and implementing the integrated thinking to decide the best care for clients. And it is important to implement the social sciences syllabus in nursing education curriculum as early studies so the student will be able to apply in their practice, which influence the approach of their work in every task.
Hi everyone, my name is Milcah, Othniel Anak Seli, matric number 75637. So today I will present about how nurses can apply knowledge of social science in clinical practice. Generally, social science focus on the relationships among individuals in society. In order to provide the patient with the best care, nurses have to combine their knowledge of biological, physical and social science with their interpersonal and problem-solving skills. Therefore, nurses can apply social science in clinical practice by understand the patient health conditions and understand the patient culture. Understand the patient health conditions. Social science can help the nurses to understand the patient better and able to provide genuine care and create an accurate diagnosis. Nurses not just treating the patient illness, but they are also increasing the quality of the patient life when they understand the patient's mind and heart. Social science help nurses to understand that treating a person is a process that involves more than delivering medicines. For example, a nurses need to have appropriate connections and understanding while giving care of a patient, which is why social relations between nurses and patient are crucial. Understand the patient culture. In today's interconnected world, nurses must be prepared to interact with people of different culture and communities, and social studies are prepared them for this. Through social science, they learn to understand and appreciate cultural differences and have meaningful interaction with people from different backgrounds in the future. In clinical setting, nurses will see many cultures that have different ways of thinking about healthcare. For example, people in some cultures believe illness is the will of higher power and may be more reluctant to receive healthcare. So the nurse should be able to understand their belief and culture, but at the same time trying to educate and explain them about the medical treatment and should be done and why it is important. That's all from me. Thank you.
Hi, my name is Muhammad from Azman and my matric number is 73590. I'm going to explain on how a nurse can apply the knowledge of social science in clinical practice. As a nurse, we can apply the knowledge of social science by knowing and understanding the human behavior in clinical practice. Every human has its own characteristic and uniqueness to define and represent who we are. Humans will behave differently when they react to something due to their different personalities. As a nurse, we must know how does a human behave in a certain way. By learning and understanding the human behavior, we will be able to understand and predict the behavior of the patient as well as understand the patients better. As a result, we don't really get offended and hurt when the patient does an unexpected thing or bad thing to us. It's because the patient might not know how to express themselves. Besides, when we do understand the human behavior, it helps us to carry out a good intervention and to help patient, because we could know the patients better. For example, a child might be scared of medicines. It might be because they find it unpleasant or they don't know how they have to take this. So we have to deliver the medicine in a very polite way and good way. Next, as a nurse, we are going to work with many people, especially the healthcare members, such as doctors, pharmacists, and other nurses. And this is the reason why a nurse has to understand and know to handle and discuss while working with other different people in the work environment. Freud's personality theory stated that there are three parts of components, which are ID, ego, and superego. These components develop in different stages in our life. There must be different traits or characteristics of all people that we're going to interact or connect with. So we have to be professional by having a good relationship and knowing each other better. For instance, we might not be agreeing with other people on some issue like the suggestion or intervention due to different opinions. So we have to discuss with each other in a really good manner without having a fight and making the situation worse. At the same time, we are able to help each other to enhance our knowledge and our skills to be better. Thus, we are actually being fascinated with human behaviour forever.
Hi, my name is Anak Intani. Today, I will explain about the importance of the social science knowledge in clinical practice. The importance of social science knowledge is to help the nurses to approach the patient on the emotional level, control level, and intellectual level during the clinical practices. Firstly, the social science knowledge helps the nurses to approach the patient on the emotional level. The emotional intelligence is an essential skill that needed for nurses during the clinical practices. This is because the nurses that apply the skill will be able to understand their own emotion as well as others. Therefore, the nurses will more concern the patient's emotion at the specific situation, especially during the clinical practices. The nurses that apply the emotional intelligence will have the ability to handle stress or challenging situations during the clinical practices. Besides that, the nurses also can improve the communication skill if they approach the patient on the emotional level. Other than that, nurses that alert to the patient's emotion will be more caring and sensitive without being judgments to any situation during the clinical practices. Secondly, the social science knowledge helps the nurses to approach the patient on the intellectual level. The social science knowledge helps the nurses to be professional during the clinical practice to stay calm and explain gently to the patient. Other than that, it helps in maintaining empathy but avoid the emotional attachment during the clinical practices. Besides that, the social science knowledge also helps the nurses to use the assessment skills, clinical thinking, and use of advice. Last but not least, the social science knowledge helps the nurses to approach the patient on the intellectual level by build the accountability of the nursing by accept and demonstrate the high level of individual responsibility. Last but not least, the social science knowledge helps the nurses to approach the patient on the control level. It helps the nurses to improve and able to give best medical care to patient during the clinical practices. Other than that, the social science knowledge helps the nurses to act professional nursing and positive attitude towards differences control. Besides that, it also helps the nurses to develop the respectfulness in the nurses to work respect the device control when handling clinical practices. Lastly, the social science knowledge helps the nurses to improve by build the positive attitudes of the nursing to not judging or degrading a patient belief and religion background, but encourage them to do what works best for them. That's all from me. Thank you for watching.
In this part, I'm going to talk about another importance of social science knowledge in clinical practice. Another important is that it can improve the quality of nursing practice. The nurse can understand their patient emotional behaviour and state better than before they practice, such as the nurse will understand the patient feeling or condition. Is the patient feeling lonely or not, and the reason to why they're feeling lonely. Besides that, is the stress they accumulate when they are entering the hospital, which make them sometimes feel angry or depressed, can also be detected by the nurse, which also improve their social science. After that, the nurse can easily approach the patient so the treatment can be done more smoothly. It is Also because when the nurse have gained the patient trust, the patient will open up with the nurse, and they will sometimes listen to what the nurse has to say and will cooperate with their treatment. And finally, it can also boost the nurse confidence in oneself. The social science knowledge can help the nurse to reflect on their own practice, which is also mean that the nurse will learn more on which he or she should need to improve or learn and correct the mistake they have done in their practice.
Using social scientific concepts to find solutions in the healthcare system will not be a simple solution, but it has the ability to contribute to develop confidence. Nurses who care have a variety of characteristics, including understanding and practical abilities. Both can benefit from social science research. Nurses also must have information about the experience of the others in order to develop empathy. And the social science have contributed a great deal to this in the past. The social science can also be used to inform the practical care. Individual requirements will vary depending on their circumstance. Permitting a self-care for someone living in poverty, for example, will involve some quite different consideration than enable self-care for a patient who is financially comfortable. Even if the medical condition is the same, as a result, gaining a better understanding of a social context offers a lot of potential. The social science have the ability to facilitate reflective practice, allowing nurses to question ineffective or treatment methods with a greater confidence.